This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about how to get rid of psoas pain. If you like this video, we put out new content weekly, so please like and subscribe. So psoas pain, also known as pain in your hip flexor. That's pain kind of right in your groin, and sometimes you'll strain it. You might hear some clicking or popping in the front of your hip. If you have those sorts of symptoms, then you probably have psoas tendonitis. A hip labral tear can also act like that, and there's a way to tell the difference between them. But a lot of people are walking around with just kind of this mild psoas pain, which is clicking and popping and preventing them from taking full steps. So how do you get rid of it? So the best thing to do is just to stretch it. So there's a specific stretch you can do where you essentially stand and you put your hands on the wall, and if it's my left hip here I'm stretching, you kind of just lean back almost like on a lunge, and you'll feel the stretch right in the front of your hip. And that is by far and away the best psoas stretch. If you do physical therapy, they're going to have more stuff for you to do, but by far and away that gets rid of most of it. Another option is, if that doesn't do it, you can do a steroid injection into the psoas tendon sheath. I use ultrasound when I do that, because it allows me to see the psoas tendon, and also it makes it sure that I don't hit the femoral artery, which is a little further away. But if you were doing it blind, you certainly could hit that. That can help a lot too if someone has this psoas pain that just won't go away. Surgery is not really done too much for the psoas. People would do psoas releases where they just basically cut that tendon, but really not commonly done, extremely rare. For most people, stretches and sometimes a steroid injection will help. Now, if you have a lot of growing pain, it can also be other things. It could be hip arthritis or a hip labral tear. So if you think it's psoas tendonitis and it's not getting better, it might be worth getting an MRI of your hip. If you're going to do that, you want to get one with contrast, meaning they inject contrast into your hip and then do it, because you can that'll show labral tears. If you don't use contrast with an MRI, you might miss a labral tear, and I've seen that before. So again, psoas tendonitis not getting better. It's been a long time after stretching. You might want to look into it. So I hope I was able to answer your questions about how to get rid of psoas tendonitis or hip flexor pain. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond. But I can't give you medical advice about your specific condition. If you like this video, I put out new content weekly, so please like and subscribe, and thanks for watching.